We're just chatting, so we're just going around and saying who we are. Just quick intro. Who wants to talk next?
Well, we need to hear Simon now on the recording. Simon, tell us quickly about.
Hello again, everyone. So yes, so I'm Simon. So it's the third time that I'm participating to the project of Viz For Social Good, and it's a real pleasure this time to have the chance to talk with you guys, because it's really a project that I really enjoy participating every time. So yes, so I've been dealing with data for 12, 13 years now, and I used to be in London, so now I'm back in Paris. So here I am.
Cool. Who wants to talk next? Nicole. I'm just pulling fingers.
I'm Nicole Clawson, so I'm Senior Decision Support Analyst at Emory. And this is my first time doing Viz For Social. Very excited about the project and working with you guys, and I'll definitely be a participant moving forward.
Oh, maybe Vivienne?
Hi, I'm Vivienne Wong, and I am a graduate student at Duke University. And this is my first time doing the project, and I am relatively new to data. I'm still learning data analytics. So nice to meet you.
I don't know. Lali, you want to talk?
Hi, everyone. I'm Lali. I'm a data visualization designer from the Philippines, and it's my second time to make a submission for Viz For Social Good. Yet it's my first time to get my work chosen. We learned a lot from you guys, and yeah, looking forward to this round 2 of the Q&A.
And Joanna, how do you say your first name? Joanna?
Yeah, sure. Joanna is good. Yeah, I'm Joanna. I'm currently a graduate student. I'm right now in Sydney, but I'm originally from Indonesia. And yeah, this is my first time participating in Viz For Social Good, and yeah, it's really interesting and yeah, very great experience.
Cool. And Sonia, above you, well, I guess in the video, we've got Kevin from the US. He's a good mate, so he's also part of Viz For Social Good, like myself. So he's running some activities in the US. So Kevin, you want to say a few words?
Sure. My name is Kevin Laylor. I work at JLL as a data fluency czar, trying to spread the literacy out to all of our users so they can work with all of our BI creators to create all these great dashboards. Been working with Viz For Social Good since 2018. So lots of projects, and love to see what everybody creates. And I love to see the background of the users and how their background comes out in their visits. It's always fun.
And we got Sonia.
Hello, everyone. I'm excited to be here today. It's actually quite a warm evening here. I'm at the Sunshine Coast in Australia, and it's very warm at the moment. So I'm really excited to listen to you guys about your PowerPoints, how you even as Dr. Kevin was saying, how you've put it all together. It was really interesting for me to look through so many submissions, and the styles were really quite apparent. So I'm really excited about listening to you guys today. And it's wonderful to see our service represented. It's something Dr. Nova Evans and I have been on the ground for some time, working hard, and it's very difficult to find any time to represent our service. So I loved what you guys did. So thank you so much.
Cool. Sonia, I think the agenda is pretty fluid and loose. So what I was hoping you to do is give some feedback to the finalists, but also because Simon missed out on the presentation last week or 2 weeks ago. If Simon, you got some time and you got your slides ready or your dashboard ready, yeah. If we give you a few minutes, 5 minutes, you can present.
Sure.
And give us a chance to see what you've done for the group.
Oh,
and for Sonia.
With pleasure. Let me try to.
I might just need to allow you to share your screen.
Yeah. Okay. Yes.
Cool.
So tell me when I can. Can I now?
Yeah. No, you can now.
Okay.
If you share your screen, and we'll let you talk for 5 minutes.
Okay. So do you see?
Yeah,
the Viz?
we see your screen.
Yeah.
We see your Viz. So you got the floor.
All right. Okay. So, so first of all, I did enjoy working with the colors of you know, we got 3 colors basically to use, and you know, that allowed me to contrast well, you know, with the elements of the design. And you know, I put a white background was great to play with. Just the colors itself was, you know, didn't need to put much on the background really. So that was a real pleasure to play, you know, with the pink and the yellow and the pastel colors. So that was great. And then I tend to use, you know, more rounded shape, basically. So circle here, you know, for fluidity in the visualizations, basically, is all about, you know, circles in the Viz. Then about the storytelling, I attempt to understand, so who's coming, right? So in terms of, you know, the homeless and the woman, so that's something I'm going to talk to in a few minutes. And I try to understand where they're coming, when they're coming, during the day and over the years, and then what is happening in terms of activities, programs, and services. So that are the questions I tried to understand and answer. Then in terms of data, basically, so what I understood is, so I'll take my note here, is that from profiling, we have older people that are coming, basically. So older and more homeless, just talking about 20 to 21. So I have to say something as well, because the data here, we have 4 months from 2019 and 5 months for 2020, and we have all the years for 2020, for 5 months for 2021. So I didn't, all the numbers here are not about absolute numbers, they ratios basically. So I tried to, because we couldn't compare years against years with absolute numbers. So it's all about ratios. So I understood that older people, more homeless people from last year, and basically more male people, less women, right? So then if I move on to frequentation, I did look at the time of the day they're coming. And so here we have the 2021 data. And this is 2020, and this is 2019. So we see that they're coming more in the afternoon and less in the morning, basically. I'm just comparing about 2020 this time, yeah? So they're coming more in the afternoon and late in the evening. Then over the year, I did see that in May. So in May, we have a peak of frequentation. I'd like to know if in 2019 we have the same peak and so on, because this is quite interesting here that we have this peak here. I don't know what happened in that months of the year last year, but it's clearly that we have something happen in that month last year. Because we can see that we have the same trend here from last year and this year, but this time here, maybe you can explain afterward, understand what happened last year in that particular time of the year. Then we move to what is going on, the evolutions, against within ratio over those 3 years. So in yellow we have 2019, in pink we have 2020, and in the pale pink we have 2021. So what we can tell here in terms of programs is that Fraser Coast used to be 3% of all the activity last year, and then they moved to be 10% this year. So we can tell that Fraser Coast got more, more activities happen here, while Sunny Coast we have a bit of decrease. So they used to be 80% of the frequentation to move to 60%. So there's a bit of a movement between Fraser Coast and Sunny Coast, Sunshine Coast. Sorry. Then when we move to services, we can tell that in the same way of looking at the data and read this graph is that we have service provider conversations that move from I don't know, 3% to 10%. So something going on here in the service provider conversation. And then we also have this here, so the biggest services, which is patient conversation, that increase as well. And then what we have, so we have a decrease here, for instance. I don't know, allied health, and also medication education dropped. So this kind of things you can tell about, the quick learning from this visualization kind of services is going up and down. It's about movement in activity. And then so the last part is about call to action and engage people to click and volunteer and move to your website and follow you on the social media, basically. So in a very quick description, this is what I tried to show you here.
That's pretty cool. Kevin, you're teacher or professor. Do you have feedback? I'm putting on your spot.
Put me on the spot. Well, I'm gonna fall back to my usual discussing colors and things, and saying that the Sunny Street colors work really well for us who are colorblind. Except the pink on white and the yellow on white are a little tough to see unless you make them strong. So when you use the strong pink and the strong yellow, that shows up good with the white background. When you use a pale pink and a pale yellow, then it's hard to see with the white. And so I encourage everybody to use a colorblind checker. There are several of them out there, and I can send them to you if you haven't seen them. But it's always good to check that. But no, the colors, because of Sunny Street on this project, worked really well for us who are colorblind. You've got good white space. I mean, it's a really nice infographic.
I'm sure Sonia has lots to say about if all the submissions. But before I open the floor for Sonia, do you ladies have any questions? As I said, there's no real formal agenda, so it should be Q&A, free flow kind of thing. So maybe I can ask you ladies if you have any, even for Simon, if you have any questions to Sonia, and then we just back and forth. And after that, we'll let Sonia give us some feedback. So any burning questions so far about the project, about Sunny Street?
As I mentioned, the in terms of analysis, do you have more data in that we can maybe add for later? What I mean is that it's a bit of a shame because, going back to what I said, I'd like to understand what happened here. I don't know if I'm still sharing my screen here.
Yeah, we can see.
Because I don't know, the business itself, and I'd like to know if you can give me some ideas about what happened last year in that time of the day. Is that because it's about seasonality? It's happening here before the summer or something, or?
Sonia, tell us what happened.
Yeah, so this is so that's month, right? So that's May, the month of May.
Yeah.
Yeah.
So that's 2020, 2021.
Yes.
And 2 years ago.
Yeah, beautiful, absolutely. So when I look at that, it actually was really interesting to see that it almost in May, there seems to be a pattern on a couple of those years there. With 2020, I think with the only thing I can think that's really influenced it is the lockdown. I think it started all happening around January, February. By March, we were well and truly in the whole scenario. It was horrible. But what we saw was, by May, Traditionally, we have a lot of people we see anyway in that space and that time, and then there's dips at other time around December and January, but it just increased. And I think when I looked at our statistics, I found that we had less volunteers, but almost double conversations in that stage as well. And we had a lot of people coming for help. They weren't necessarily homeless, but they were in distress. And so we even had professionals, so doctors, nurses, accountants. It didn't matter what people were. People were also starting to sell houses and all that kind of thing. So people started to lose their homes and were in great distress. We also saw major issues around universities with international students, any student who couldn't get home, who had great difficulty as well. And we actually had students come to us with suitcases and their belongings. So we from March, we've just started to see a climb in people who we didn't normally see out on the streets. And so I think even though May is normally a tough, obviously May, June is tough anyway. And I'm still not sure why that is, to be honest, but it happens every year. But yeah, I think COVID definitely helped the rest of the community seek support as well. So people that weren't necessarily homeless, so it didn't bump our numbers up in relation to homeless people, but people who couldn't access, support and didn't know where to go. So that's the only reason I can think as to why that year just shot up. Yeah, I'm pretty sure that's why. I think essentially that entire year was higher than most years anyway, because of the distress and the pandemic. Yeah, so yeah, it was frightening for a lot of people. It's probably, we typically are a crisis centre. If you're seeing Sunny Street, you're in a bit of trouble. But we had people ringing up, working from professional backgrounds, hospitals, saying, "Oh, I think I might be homeless soon, and I didn't think I'd ever be in that position." So we were kind of, no one knew who to call. So it's the first time that's actually happened to us. So yeah.
Did you also have telehealth sessions starting around the same time or a bit after?
What was that? Sorry, Frederick?
Did you have any telehealth sessions, like over the phone kind of?
Yes. So we also started telehealth. What that did was that also increased our consultations because it made it a national service very quickly. So that definitely, actually, Frederick, you're right, that would have also increased the consultations. We've settled that down now because, people are allowed back out. But yeah, that would have contributed. We actually also did marketing around that, and we had a fantastic director who did a video and pushed it out for us. We were on, also on local TV to try and get people to have conversations. So we had, I think, every area in Australia outside of Adelaide that rang in. So yeah, and that time was a really hard time because by March we all knew something was going on and we're all in a bit of strife. But by May, it started to hit us all. So yeah, it's great to see it there, Simon, actually. And I love the way you've also just that, the circles up the top. It's just quite easy to read. It's interesting that the homelessness rates, they obviously have increased from 2020 to 2021. And as you say, my frustration around this data is having half a year, in 2019 and half a year in 2021. Yeah, that's a frustration. But yeah, I can see that. And women are our, I love the way you've captured that, because women are our second highest group, but men aged between 35 and 55 are our largest group because, they're the last to be housed. Women with children end up being housed first, then women, men with children, and then men. So we have men on the streets who have just been on the streets for a long time, and it almost breaks them. And they will say to us, it's been too long now. So yeah, we had one gentleman the other day, and he said, we said to him, how about, he's sleeping in his car, he's been doing that a long time. And we said, how about we give you a motel, for a week, and so you sleep, and, and he said, I won't take it because I know I'm going to have to go back out again. So I'd rather not feel what it's like. I'd rather, because it would make him so incredibly sad to leave. So it's men are our highest group, absolutely.
And great, Viz, Simon. I think it's very clear. I really love the way you treated those charts. The charts and graph tableau charts, but you don't see them. I mean, they're there, they're not there. They just blended with the story. I think that's really amazing.
Mm.
I tend not to go for complex viz on this one. I try to just donuts and trend lines and just progressions, not something complicated to read.
Yeah, well, that's cool. So Sonia, did you want to go around and give feedback to the volunteers? Well, how do you want to play that?
Yeah, sure. I actually also just want to say, Simon, I loved your 19, 20, 21 circles on the activities, programs and services. It's so easy to compare. And I know we're dealing with half yearly information. Sorry, Frederick. But that's fantastic. It's one of the reasons I loved this display, because I can clearly look at that and see complete anomalies. And for me, it's probably where we don't have that comprehensive data, but even things like, patient conversations and Fraser Coast, I know why that's up and down. So yeah, that was, I just love the way that was set out, really clear, really obvious with the colors as well. And I loved the, on the side where it says the activity. So that was fantastic, Simon.
Thank you very much.
And also, Sonia, I think I've sent you an email yesterday. All the volunteers have saved their work in PowerPoint as well, which I've shared in Dropbox. So I think there would be 5 or 6 of them. So what you see there is a Tableau dashboard, which is web-based, but you could use the same graph for PowerPoint if you meet with people. Or
absolutely.
So I think if the stuff you like, we can always contact the volunteers and get a different graph or something similar or whatever. So I think the discussion should continue.
Absolutely. No, fantastic.
It's a pleasure,
Simon.
Thank you.
Okay. Might just have it. Is it okay if I just keep going, Frederick? Is that
yeah,
right?
go. Yeah. I think talk a lot.
I'm just going to have a look. Is it Johanna?
Simon, if you can unshare yours.
Yeah, sorry.
Frederick,
Yeah. I'm
stuck
there. Yep.
Cool.
Yep.
Yep. Can you see my screen?
Yes. Yes, beautiful.
Should I present again?
I don't mind if you just do 5 minutes, if that's okay.
Yeah, sure. No worries.
Beautiful.
Okay, so the first is it's just a brief introduction in case the audience who read it don't know what Sunny Street is. So yeah, just a very brief one. And then this one is the problem statement. So yeah, it's just basically big numbers so that people can really visualize, oh, this problem really happens. Because these are the stakeholders, the people who Sunny Street are really helping, like the homeless people who probably could have admitted to hospital care if they don't go to Sunny Street, people who need mental health support, and also substance use disorder. So yeah, the numbers are really, just to show that this problem actually exists.
Mm.
And then this one is where Sunny Street operates. So in total, there are 20,334 interactions. And if you see here, there is this trend line. This is the accumulative total interactions. So we could see how initially in the early 2020 and before it was a bit more flat compared to after. We could see it's actually around after COVID, it really becomes faster, the growth rate, and it kind of slows down a bit in the 2001. So this one is just more for exploring. So we could see this one is pretty big. It's in Sunshine Coast, the number of consultations and the number of conversations, and also the total duration that it opened. So, and then the next one. So this one is just dividing the total interactions into the number of conversations and consultations. So we see here conversation is really big. It's 16,000 something, or consultation is 3,000. And this one is also the cumulative growth. And yeah, we can see it's a bit similar. And yeah, and here it become more faster after around April 2020, which is slightly near COVID. And then this one is the breakdown of the consultation, which one is the highest, and also the conversations. So you see here, patient conversation is the highest, the smallest is suicide prevention. For consultation type, the biggest is nursing, and then the least is nurse practitioner. So for conversation trend, this dotted line here, it represents when COVID hits. So that's like when the border is actually closed on March. So what is interesting is the peak has always been nearly, it's May 2020. This one is June, which is pretty near after COVID hits, only with the exception of suicide prevention, which is the highest at November 2020. So yeah, pretty interesting why it's the highest at November, although the others are the highest near COVID. While in consultation trend, overall, usually it get a bit higher, like allied health after COVID. This one, yes, after COVID. This one, well, it's overall trend, it's kind of decreasing, although it has its peak after the pandemic. And also telehealth, of course, because it just appeared after the pandemic. But for nurse practitioner, it was actually more higher before the pandemic. But after the pandemic, it kind of hits lower. The highest was only 7 on July. So yeah, it's not sure why there's less people who go to nurse practitioner. So this one is more of an analysis of which day is actually the busiest. So it's measured by the potential number of interactions. So it also measured the number of patients which are turned away on that day. So we see that somehow in every year, it's always the highest number of patients who are turned away is on Wednesday. And yeah, it's quite interesting because even if we see this, if you see the yellow line, this one is the total duration that it opened. So if we see here, yes, it's lower than Tuesday, but then the difference is actually higher than compared to Tuesday. So actually, hypothetically speaking, Tuesday should have actually a higher number of patients than away. But then it's always Wednesday, and even we see in 2020, and yeah, in all the years in 2019, it has always been Wednesday. So this one is the knowing more about the patients, so who Sunny Street are actually helping. So in terms of age distribution, this it has always been a bit similar. The age segment has always been 41 to 50 and also 51 to 60. It's a bit similar, not really changing, although only in this year it's getting higher, 41 and 50, but yeah, it's overall similar. And yeah, we can see here. So yeah, I just included some pictures here just to better imagine who the patients are. And yeah, we can see the highest is these two age segments. And then in terms of ethnicity, yeah, it's also pretty similar. It has all the majority is always Australian, and then followed by the indigenous descent. But yeah, mostly are actually not provided, so yeah, it's a bit hard to interpret. And then this one is also for gender. So for gender, we can see that the majority has always been male. And yeah, in 2021, male is particularly the makes up the highest proportion compared to the previous years. So yeah, it's actually somehow the diversity isn't really improving. Although in here 2020 it's like it's slightly better compared to 2019, but then it kind of the balance kind of worsened in 2021. And then for the homeless rate, yeah, the trend has always been similar. It's around 40%. Only except for this one, just below 40%, it's only at 2020. And yeah, maybe this is because of COVID pandemic, like what Sonia has already explained. So there's actually more people who were also not homeless who visited Sunny Street. Then this one is the feedback sentiment. So pretty much actually most of the patients are actually satisfied, because we see that there's actually more people who speak positively about Sunny Street. Although this one is mostly neutral because it's missing any feedback. So yeah, I just classified all those missing feedbacks into neutral. So it's actually not really that much negative feedback. This one is 4 patients, and then this one is 1 patient. This one is 1. This one is 1 also. So yeah, not really much actually. Then yeah, lastly, this is how the ways people who are reading this visualization can actually help. They can donate, volunteer, collaborate, and then lastly they can click here and and be linked into that website. So yeah, that's pretty much it.
Awesome, thank you so much. Could you just head back up to the top? Is that okay, Joanna?
Yeah, sure.
Oh, thank you so much. I loved the beginning of this. I loved your block numbers, how you've got this 21,000 people, 2 million admitted to hospital care. Those kinds of numbers are important to us. You know, it'd be really fantastic to look at what those admissions were and where Sunny Street impacts. Yeah, I really, really enjoyed that. If you could just head down a little bit, if that's okay. And the operation, yeah, we've primarily stuck to the Sunshine Coast, and I love how you can zoom in and get further information on that. So it's really quite specific. I love that kind of fantastic ability on a map. Then you've got consultations and conversations, and you just here you can just see the increase from the beginning. It doesn't stop. Unfortunately, it just gets worse for us. The nurse practitioner is so small, and on the other one, it looks like there's no nurse practitioner because the nurse practitioner left. So that will be why. The telehealth also picked up, and we advertised and then dropped off as we could see more people physically, because you know, to see people, you know, we found a lot of people just wanted to be hugged or had to have a conversation rather than any kind of digital anything. The patient conversations, what was I going to say? Oh, yes. I love how you picked up that the conversation trend, you know, was up in May, as Simon found too, but suicide ideations and issues like that were actually, you know, peaked in November. And then it's really, really, it's not fantastic to see at all, but it's great to see on here, because what happens for us is Christmas is a horrible time. And so about 6 weeks out of Christmas in November, that's when we have a lot of men and women on the streets who have really disjointed families, and they're not seeing their children, their kids are in foster care. And so 6 weeks out of Christmas, we have to start doing suicide prevention planning. And sometimes we've had to have day-to-day plans to keep people alive. So so that's why there's that peak. And then over Christmas, we close for 2 to 4 weeks, depending on the service provider we're with. So that's why you see that decline there as well. It's fantastic to see this like this, Johanna, because it's you know, it just such an honest story about what's actually happening. So yeah, thank you. If you could keep going up or down. Which day is the busiest? Yeah, it's the missing people, the people being turned away on the Wednesday, I think is because on the Wednesday, we're understaffed at Fraser Coast, and that's a Wednesday clinic, but also Wednesday in Brisbane, you know, there's 140 people. It's one of the biggest clinics and we don't have enough volunteers. So the potential for more conversations are there, but we just don't, you know, there's not enough volunteers for that, and not enough time for two hours. So it's really great. I loved how you have the year up top right, and you know, you can just go through, it's so very clear, and you can just see those trends. That's actually quite fantastic. And I had no idea that we were turning people away every Wednesday for the last 3 years almost. So you're teaching me things I have no idea about my own service. The age distribution, sorry, is very typical. The not provided with ethnicity is a big issue, because sometimes we really see people on the streets who, especially Indigenous kids around 8, 9, 12, 10, 12 years old, who are sleeping rough, and may have been manhandled by police in the parks or all kinds of things. And, you know, quite often we've got to, you know, try and care for them, and they don't often provide a lot of information. They just would rather usually come up and say, hey, miss, can you fix my wrist? Or, you know, and so there's very limited information. So it's also, you know, men on the streets don't like to give their information much either until they trust you. So yeah, it'd be great to see a true representation, but trying to get information off people when they're not quite trusting you or they want to run is really hard for us. So yeah, that I just love the way that that's so obviously displayed, Joanna. I think the age distribution and the way that you put the pictures together there is super clear. Anybody can absolutely read that. The homeless rate, and I should have said this with Simon too, the other thing I thought of, see how in 2020, this is really fantastic, the way that you've, you know, you've got the pinks and the yellows, and it, you know, until this year, it was the first time I saw how many people weren't homeless in the service. This Viz For Social Good this year really highlighted that. And the other reason that there were less people homeless in 2020 was because, you know, every time I see this data from you guys, it just makes me think about the service and what the trends are. And it's because there was a mad rush to put people who are homeless in motels, and, you know, push them out off the streets for a short-term period of time. So yeah, that happened actually for a good six to 8 months in that year. So I'd say for a short period of time, they weren't technically homeless, but they kind of were, because they didn't have permanent tenure anywhere. But certainly, you know, people just moved them off the streets and out of the way. So yeah, and also the patient and service provider feedback. I'm really interested in those neutrals, but in that, and that's really clear as well. So that's fantastic. I think that's really quite obvious as well. I think I love the way you've used different ways the entire way through this to display the information actually. Yeah, very readable. And a patient quote. I know who that patient is. He's lovely, absolutely lovely. He wants to call us the Sunny Street Angels. And then the bottom where you've got that call to action and you've got the 3, and the click here, the lead in. That's wonderful, Joanna. That was a pleasure to actually look through, and you taught me things about, like Simon's as well, about my own service I didn't know.
Thank you.
Who do you want to hear next, Sonia?
Lally. Whoever wants to volunteer. This is so much fun.
I guess it depends on time as well. If you guys are pressed for time as well, if someone needs to go to work, or I'm talking about people in the US or in Europe, you speak out and tell us if you want to present first.
I was to stay here, then go to work, actually.
Well, that's perfectly fine by us. It's a great group.
And I really love the fact that you said that data really help you understand your services, and I think that's the whole point of using data and visualizing data, as we do for work, is really you understand your project or your business better, which I think is pretty cool.
Yes, it helps direct where we head to, or why certain trends are happening, because Viz For Social Good has been so fantastic. Each year we've participated and we've realized there's trends, or that we need to make changes as well. So so it's been quite fantastic. Or we have to be clear about the kind of data we're asking for. That's the other thing as well. So yeah, it's been wonderful for us.
Lally.
All right, so hi again, everyone. I'm Lally, and I also created an exploratory dashboard similar to what Johanna did. It's really a lot of just filtering and clicking on these different marks to understand what exactly is happening in different activity centers, as well as for each of the interaction types. And I think I've arrived at the same insights as Johanna. But for this presentation, I just want to focus on the trend analysis that I did and the key messages that I've come up with from these analysis. All right, so I was able to come up with 4, and the first one is that there's potential for growth in Brisbane, the second largest region next to Sunshine Coast, when it comes to interactions. Now, of course, there are less activity centers in Brisbane, which could possibly explain the lower number of interactions. But in reality, according to the 2016 census, it has the highest population among all 4 regions. That's roughly 6 times than that of Sunshine Coast back in 2016. And also for the same year, it's been reported that there are roughly 6,000 homeless people in Brisbane, or that's 28 homeless people out of 10,000. So there's a lot of opportunity to help more people in this area. Now, the other supporting point to that key message is the slow yet steady and continued growth in Brisbane. Now, the numbers are definitely much lower, but you can see that there's a slow and upward trend since 2020. There are some noticeable dips, which could possibly be due to seasonality. And of course, there's that sudden drop around April. And this is around the time when restrictions were imposed in the entire Queensland. So yeah, those 2 things, the population size and the continued growth in Brisbane, could explain why there's potential for growth in here. And so as for my recommendation, perhaps it would be good to increase visibility in this area by having more activity centers, clinics, if the budget allows it, and by doing more advertising and having a stronger social media presence. So the next key message is related to the trends during the spread of COVID. So the highest peaks in interactions occurred months after the restrictions were imposed. And according to Brisbane Times, at around March, Australia was already in lockdown, and residents in Queensland could be fined for leaving their homes. All right, so we can actually notice these peaks in this area graphs, right? So specifically from May to June and September to November, since the spread of COVID, we have seen the highest number of interactions, these highlighted ones. And this pattern is evident for each interaction type. And also for each of the specific interactions. So it's all a similar pattern, highest peaks on those periods. Now, of course, this is just like a historical presentation of the data, but I think that what we can derive from this is to determine like how we're responding to COVID recovery. And I guess moving forward, what we can do when it comes to data is to track if the patient visitation is related to COVID or not. Can be simple details or minor details such as the patient being vaccinated, inquiring about vaccination, if he's a recovering patient, or how he can prevent COVID, or just general inquiry about COVID. The third key message that I've come up with is that education sessions were widely conducted and appear to be popular among patients. There's wide interest in this type of interaction amidst a pandemic. And as you can see, in the periods between August to December of 2020, comparing that with that of 2019, there's a sharp increase in number. So that's roughly 20-fold increase for health education and medication education sessions. And for mental health, it's roughly 7 times. But we can also see the similar patterns in these top 3 interaction types. As for recommendations, I think it will be more related to the data. I think it would be good to know the length of time these sessions take and find ways to make them more efficient, like when it comes to logistics and execution. It would be also good to determine who attend these sessions, basically tie in the shift or log data with the patient data. And in this way, we can see the history of patients attending these sessions and who are also availing the other services of Sunny Street. And since they're quite popular, I think that it can be leveraged further to have a wider reach for these sessions through social media. The last one would be there's a growing interest in mental health conversations. You can see that for both the first and second half of 2020, there's a continued rise that lasted for about 6 months. That's for both mental health and suicide prevention consultations combined. There is a steep decline at around July, but from there it went slowly up until the just before the holidays. Now, looking at specifically on suicide prevention consultations, as mentioned by Simon, I believe, or was it Johanna, around November, the highest number of suicide consultations occurred. And the numbers are specifically coming from Sunshine Coast. And the trend is not evident in Brisbane, although more than half of the total consultations come from Brisbane in December of 2019. So my recommendation for this is to also conduct education sessions that raise awareness on mental health issues. I mean, we've seen in the data that the education sessions are related to health. But it's not too clear if it's physical health, mental health, or other issues related to health. Right. So since there's a growing popularity in them, I think that it would be good to tackle mental health as well in these education sessions. And as a recap, 1, increase visibility in Brisbane. 2, track if the patient visitation is related to COVID moving forward. 3rd, improve data entry or collection. Basically make the shift data and patient data related so that you can maximize the insights that you can get from them. And 4th, conduct education sessions that can raise awareness on mental health. And hopefully those recommendations will help in garnering more positive feedback. This is straight from the data itself. Patients smiling and happy to see a Sunny Street nurse. Thank you.
Thank you so much. They are quite often happy to see a Sunny Street nurse. That whole PowerPoint's fantastic. I love the graphs, the detail you've gone into. You know, as with the other PowerPoints, you can see, you know, as we're talking about November, we're talking about the peaks. Love that you tracked it in relation to the COVID-19 restrictions, because that's, you know, we saw so many issues and mental health issues. That was just absolutely so well done, Lali. It's phenomenal. I can see that you've gone so much effort, you know, to depict this information. The other thing I really like is the recommendations. So, you know, not only is there data, but this is what you can do about it. This is what the data tells you to do and how you can change your service for better. You know, you've outside of number 2, you've almost tracked our future plan there in relation to our. I think when I first saw your let's say PowerPoint, your data submission, I was actually shocked to see the numbers between Sunshine Coast and Brisbane. It was the first time I saw them, and you know, we're looking at 2 million in Brisbane, and yet we have such a stronger presence on the coast. I know why that is. It's because we have a base on the coast, and we're trying to strengthen that. And Brisbane is a spoke. But actually increased visibility is one of the things we're doing over the next 3 years. And we'll be, you know, looking at starting a centre there, because like you're saying, there's just a huge capacity for us to expand there. So over the last 3 years, we've just been, you know, we've got Fraser Coast, Brisbane, you know, those areas, but we've been solidified in Sunshine Coast. So that's our future plan. Track of the patient visitations, COVID related or not, that would have been fantastic. Hindsight would have, that's great. I wish we did that. It's more that it was more qualitative. We just knew, you know, with students turning up or people just, but that would have been fantastic in relation to that. Improve data entry, absolutely. We're always trying to look at ways to do that. And as you guys know, you had to work through BP data and also Volaby, and the conversations don't always translate into a consultation into BP. So there's a lot of real you know, information missing there. But yes, oh, my goodness, yes, we need to improve our data entry. And also the conduct education sessions. This is also a future thing, Lali, that we've been looking at too. You know, I lie in bed awake at night thinking, you know, are we a mental health service essentially? And so, you know, and there's that the direction we take. And of course, then, you know, that relates to number 3 in relation to how we improve that, you know, collecting data around mental health and how we show what we're doing as well. But I just loved the in-depth graphs you had. The fact that you recommended based on your information, absolutely love that as well. And yeah, so, you know, that's got a future focus for us. But no, it was that's absolutely fantastic. Thank you so much. And like you know, Johanna and Simon, I just learned more things about even regions that we're actually in at the moment. So we're currently got a plan to expand to Canberra next year. So you know, yeah, it'll be very interesting. So but thank you so much for all of that information. Do you have any questions at all, Lali?
None really.
Okay, that was amazing.
Sure. Thank you.
Really good. Nicole or Vivian, did you want to chat, to present, to talk? To ask
However
questions?
it happens.
Yeah.
Demo public is refreshing. Well done.
Teach me something about my service.
I loved learning about your service so much.
Yeah, thank you.
It was amazing. And, when I first got and looked at the data dictionary or in the code book, and I saw that you had, quotes in there and feedback early for us. And I'm still thinking. But when I saw the comments, I wanted to read through those first, and I wanted to read through your website first, because I really wanted to get a sense of who you were and not just what you do, which is also so important. So that's why throughout my viz, I included the quotes there to really bring it home to anyone who you're speaking with. Yeah, you have the numbers that you're doing amazing work, but let's also look at exactly what you're doing for these people and the way you're impacting them. So that's why I included those throughout. I found a lot of the same insights that Simon and Lali and Johanna did. So I'm going to kind of skim over those. But the same, I saw on your website, when you guys were starting this, the number of homeless, especially the number of children and teenage homelessness in Australia. So I wanted to dive into that and put that out there so other people could see, this is why it's so important that you guys exist and are funded, and where you're funded. I found, again, a lot of the same things, telehealth started after COVID. You had a lot of the spikes. I wanted to bring up the conversations just because for me, my background is in psychology and health, and I wanted to say thank you for all of the work you guys are doing on mental health conversations and suicide prevention, because that is absolutely important, and substance abuse too. And it's so great to see that is available. I know when you guys were, when you put out what you were looking for, you wanted to really focus on the impact that you had on the health system and alleviating the health system. And so at first, since that data wasn't in there, I was kind of playing around with it, but I was also looking up studies that were done. And so that I included a study that I found just about, people delaying seeing practitioners as well due to cost. And as you delay it, the problems just get worse and worse. So having a service like Sunny Street where you can go and kind of stop delaying it, catch it before it gets serious, will help alleviate the health system. So I included that information. The demographics, kind of as everyone has talked about, it was good to see it. And I loved your explanation on why you see more male patients than female, and the homelessness, that was a question I had. So I'm really glad I was able to talk to you about that. But then on the Slack channel, when Frederick found the data on, how much it does cost to go to an emergency room, this is where I wanted to kind of expand on that and expand on that impact that you guys could have. So I went through and I based the numbers off of the number of consultations and conversations, because even though you had the number of patients, and I think it was in Wallaby, when people come to you more than once, then that's preventing them going to a hospital more than once.
Yeah.
So with this, what I did was the average cost of the emergency room in 2014 was at $562. And so I just took that and multiplied it by the number of consultations and conversations y'all have had since 2019, and broke it out into percentages, because I know, people might have come through and had both a consultation and a conversation. I wasn't sure how those were quite coded, so it may not be 100%, but then also, especially with the conversations, maybe these conversations wouldn't have resulted in an emergency room visit the first time, but you are preventing it, down the road future, especially with the suicide conversations. So this was something I wanted to put together so that you guys had it also when you were pitching for funding, because you guys need the funding. You were just doing such amazing work. And so noticing that in terms of the consultations, as I looked at above, the nursing and paramedic are the highest. You have the most consultations with the nursing and paramedic. And so that's where, in terms of the public health system, you're saving them the most money from hospital visits. And then in the conversations, it's the patient conversations. And I am interested in hearing from you kind of the difference between just patient conversation versus some of the more specific like mental health and stuff and what that difference is. But that is where the most conversations happen. So also where you save the system the most money, and just, you know, this is millions and millions of dollars that you guys are saving them, along with, you know, saving people and them. So that was what I focused on. And then also wanting to make sure that people got involved, because as I was reading through the comments, I kept saying, we're so busy, we're so busy, we're so busy. So I flagged the number of entries that you guys had, that just talked about how busy you were, to make sure that people knew, like, hey, let's get some more volunteers and helping these people so that you can help people.
Awesome. Absolutely amazing. I you know, Nicole, when I first saw yours, I love the top of it. You know, I love that you have the photos, you've got, you know, you've got photos faded, but you've got photos up strong as well. You've got, so as well as data, you've also got, you know, quotes from, you know, patients, and, you know, which we hear all the time from our patients, you know, that they live another day or breathe a little better, or breathe at all, because of Sunny Street. I loved the fact that you looked at the, I don't even know if I applauded at the time I saw this, the actual, you know, the savings. This is the biggest thing, biggest issue. You know, Nova and I, we don't have data minds. We're a doctor and a nurse, and we an entrepreneurial, but you know, it's what I said to Frederick, you need to really look at what are we saving the health system? What is the impact of Sunny Street? Because we literally went out with an idea and a car boot full of a nursing kit. And that's, and, you know, initially we did it to make an impact in people's lives, but of course, you know, we need to look at the financial, you know, when we're looking at funding to expand nationally. And this is just, it's incredible. I love the way that it's very easy to read, and I love the way that you've looked at the different medical consults and what that would actually cost, and the average cost of the emergency presentation as well. And it's, we actually had some interviews for a business award recently, and we used some of your data and said, you know, we've saved this much for the health system in Nambour, and, you know, we're finalists. We'll see if we win or not. But you know, when we're using, like, you know, between 2.1, you know, 2 and 9 million, you know, for health services, and we're not that big yet. It's huge. And so, you know, at the moment, this data has been really, really quite helpful, because currently I'm a finalist for a national nursing award in Australia. And so, you know, from creating the service from a car boot, but the opportunity around that there's 4 of us who are finalists in Australia, but the opportunity for me is to try and get funding for primary healthcare for people who are just missed, who are just, you know, I think, you know, people consistently tell me that healthcare is free, but I think that's only true if you can afford it. It's totally free. And so I think, you know, if you've got no transport, you've got no mates, you've got no money, you've got no health literacy or limited, it's not free. It doesn't happen. And so it was, this is actually really quite fantastic. And like I said, we used this in the business awards recently to say this is the impact that we're making. So I really thank you for your hard work on this and to help us portray our story in a different way. So yes, you had a question around conversations and the differences.
Just curious what gets a patient conversation, if that's just some kind of general, you meet them, but then if they come for a specific reason, it kind of gets categorized, or just what that kind of bucket was.
Yeah, it's a tough one, because we ask the nurses at the end of the shift. So because there's so many trust issues, you know, we're dealing with people with a lot of trauma, a lot of systems, and people have let them down their whole lives. And so, you know, sometimes you might say hello and then someone may ignore you, and then, you know, the next time they might say hi, you know, it can take you 3 months.
Right.
But we include that in having a conversation, because if we don't do that for 3 months or 6 months, that person never gets to the stage where they go, well, can you have a look at this, or have a conversation with us? And conversations are kind of more a holistic conversation, you know, about how someone is. It's when we start delving into things where they start talking about their mental health, not where it's a consultation we need to intervene, but, you know, in these conversations, sometimes they're just about money or relationships or navigating life. But then sometimes they're specifically about mental health, or that they've got a behaviour, or there's medication they're not sure of, or they haven't taken, or, you know, they're on ice and they don't know whether to mix that with the antibiotics that have been prescribed. And, you know, like, so start talking about all these different things. Health education is huge. We do so much health education. I think was it Lali before, I think was also talking about that. It's massive, because there's so many issues with health literacy, and people don't take the time with people who are on the streets. They've got very little chance of understanding their own, you know, self. And so, of course, we sit and we listen and we talk and we educate. So I'd say patient conversations are kind of a holistic, generalized conversation. They build trust. They're not necessarily surface level at all, but they don't quite start, once they start getting into, you know, the fact that they're on ice, or, you know, that they're, you know, concerns around their, you know, bipolar, or that they're thinking about, you know, not living through the night and things like that. That's when we start to count them in different areas. And of course, health education. And then consultations are when it's a specific consultation, like wound care, we're prescribing something, we're taking bloods, you know, those kinds of things. So then it flips into usually BP by then, and then they're logged as a patient. They will mostly give you their real name and information, and it's helpful. So yeah, there's quite a distinction between it all, but conversations have to happen for us to get there in the end with someone. So yeah.
That trust building is so important.
Yes, sometimes you meet someone and they will tell you so much about their life, and then we had one and some people won't, it takes months, and we had one gentleman who he was, I think he's been with the service for 3 years, and he's finally only just talked about some serious trauma that occurred to him when he was younger. But it's taken 3 years of time and time and time, which you don't get in a normal healthcare setting, because it's very transactional. So when you go to a doctor or a hospital, there's that you're a patient and they're a doctor and a nurse, and you know why you're going and they know their role. So it's kind of like, you know, there's, you know, the health professional has some relative power, and understand what the transaction and conversations are. But what we do is very different because no one's coming to us. You know, we're putting ourselves in car parks, out on patios, in gutters, in parks, and people aren't coming to us with a problem. We're actually trying to engage people. So that is a whole different shift. And that's why it takes so long. So those patient conversations, it's just not that exchange. It really flips the whole model. And so that people engage with us through choice. And yeah, from there. So, but I loved so much of this, but I really got excited about the economic impact. And yeah, I'll be definitely using those statistics. I already have, but you know, so yeah, so I have to see if we win the business awards, but you know, we can actually, you know, say with confidence and actually show. So thank you so much for sitting there and figuring that out, because we know the service makes an impact in people's lives, and in our life's forever changed because of the service, but you know, economically, hopefully, if I have an opportunity to have a platform around the national award, then I can also advocate for nurse-led clinics in Australia, and use this data, because you've got, you've actually split it up into nursing consults. You've split it into sections. So, you know, if we've got 100%, we've got 1.3 million here from nurses that, you know, it needs to be funded. So, yeah. So thank you so much for your hard work.
Yeah, I've got Nicole, can you go back up to your trend lines over time right there, looking at those? I've got a drop at the bottom of the hour for work and a meeting, so I don't know if we'll finish by then, but this is a real teachable moment. So I just wanted to stop. You know how you've been seeing these trend lines? This is why we pair our data analysts with our end users, because the data analysts will look at this and see the trend lines. And like me, being in the US, I'm thinking, okay, it's hot in May. That's why we're seeing an increase. And then, oh, it gets really cold in November. And so we're seeing that increase. And then I'm like, oh no, this is down under. So it's the other way around, thinking that, okay, May is the cold season. And is that why you're getting the uptick? And then with the extreme heat in May, is that why you're seeing the uptick? And you're saying, no, what we're seeing is 6 weeks out from Christmas. And so again, you know, you know these things, you have that expertise. Maybe we don't, but after time we will, right? So if we work in this field, in this area, then we'll get that business kind of acumen to go with the data acumen. And then that's where we really get, and we find these great results. So it's fabulous. I'm really enjoying the interaction today between the data folks who found these things and asking you, what does this mean? You know, I found this, you know, what did I find in the data? Because again, this is what we want to see. And this is why I emphasize data fluency so much, to try and get everybody to understand data so they can work with the data folks to get these fabulous findings. So it's been really fun for me. I know we still have Vivian to take a look at and some closing comments, but I just wanted to interject because I know I may have to drop here soon for work starting, our work day starting very soon.
I've loved it too, because you can actually then, you know, when you're saying, what does this mean? Sometimes I'm looking at the data going, what does that mean? You know, well, why is that happening? So it's just fantastic. And then to be able to talk about it, that's why I wanted the, you know, 5 or 10 minutes for people to talk, because explaining it's very different, you know, and that way I can get the information too. So yeah, absolutely fantastic.
Yep, loads of fun. So I guess Vivian, you're next. Like I say, my apologies for dropping, but work calls.
Okay, so I think at this point I have like few things new to say. I'm just doing like demographic analysis and all the performance trend, everything, but I will go through it. And so I start with Sunny Street's mission statement and why is Sunny Street service important. I think that's like attract the users, like the readers of the visualization, why they should continue reading. And then I go through some like big numbers. Like Sunny Street operated in 15 locations, and it has seen this many patients and conversations. And it's currently operating in mainly like 3 parts and 9 locations highlighted by this red color. Then I start the patient analysis, and pretty much same with everyone else. But I just noticed that in 2021, there's a narrower range and higher median. There's like no newborns and elder people. And I am pretty curious, why is that? And also I take a look at the percentage of homeless by age, and I see that it's very interesting, like more than 50% of, oh, it's refreshing. More than 50% of the teenagers are actually homeless, and that I think that's pretty warning. Also, I take a look at the homeless percentage by gender, and it seems like male has a relatively homeless rate among the patients. Also the performance over time, the peak is in May, and there are fewer conservations in January. Then I compared the performance by January to April 2021 and January to April 2020 to get a better performance by the same period of different years. And I think I have found like for the conversations, a lot more conversations with service provider and slightly higher conversations with substance use were performed in 2021. And for consultations, more consultations were performed by allied health staff member and on telephone in 2021, which is pretty understandable. And finally, I just did a quick comparison between the patients' city locations and Sunny Street locations. And I find that it's pretty much correlated. Like when Sunny Street open a new clinic in Fraser Coast, more patients will come to these locations. And when it closed some locations, less patients will come from. So I think the more patients will come from locally. So if Sunny Street want to improve your impact, you might really want to open like more locations to different places. So yeah, that's
definitely. Absolutely. I love the comparison at the end you've got there. It was interesting to look at where people are coming from for the clinics, because we have a few that kind of, you know, go all over the shop really, and most of the rest of the states were telehealth, which was interesting. And I can see, just if you head up, Vivian, yes, a number of consultations there in 2020, yeah, was, you know, with health education, you know, the little yellow dot is, you know, out there. And we spent so much time that year alleviating anxiety, depression, mental health issues, and, you know, a lot of calming we had to do there. And actually you can see mental health is up there too. And medication is up there too. Now I see that as well. So yeah, it's yeah, it was really difficult. 2020, I actually come up in someone else's display PowerPoint before around the service provider conversations being heavier in 2021. And the only thing I can think of there is that in 2020, although we had services cease, so we don't stand alone. We actually attach ourselves to a service provider. And so, you know, people were either, you know, the services were ceasing, or it was a takeaway food thing, and we weren't able to really have those conversations. But in 2021 we were, because, you know, lockdown ceased depending on the area, and we were able to have those conversations again, less lockdowns. So yes, I'm interested that in 2020 the patient conversations look less, because there were so many, you know, I thought that they had doubled. So yeah, and if you can just go up, Vivian, I like how you've used different ways, the graphs, and I love the circles here. That's very clear. I actually love that you did a percentage of homeless people by gender, which was really fantastic to see. So, you know, the amount of females that were homeless in relation to men. Yeah, I found that quite interesting as well. And also you've mentioned here 15 to 19-year-olds. And I think nationally the statistics are the second highest group of homeless people in Australia are under 24 years. We see so many teens, especially in Brisbane. Brisbane has a lot of children, you know, 8-year-olds, things like that. And I can see there's 0 to 4 years old down there. And we had a couple of, like a 2-week-old baby and a one-year-old at clinic. We were warming bottles for the 2-week-old. So it's actually quite frightening. But youth plays a huge part in who we see, and especially girls. Yeah, especially girls 8 to 5-year-old girls. It's really, really quite frightening. So if you could just head up a little bit, Vivian. I love the way that graph is. That's fantastic. And I remember seeing this number of patients, Vivian, and I thought, that's the first time I think I've ever seen how many patients we've had. I know it's based on BP, so it'll be accurate in relation to BP, but you know, I've not quite seen that. So that was really, really quite fantastic. And the number of locations being 15. Yeah, and I love the map and obviously how you've used that too, and that it's just really easy to use and explain. So I think you've done a smashing job here, actually. And once again, just taught me things I didn't quite know about my service. So yeah. Did you have any questions, Vivian?
No, yeah, thank you so much for all the explanation.
Yeah, no, that's okay. I loved this when I saw it. That, you know, I thought I just love to hear you talk about it more and understand more. So, so thank you so much. And it's very clear and very colourful. Goodness, Sunny Street's colourful. I'm looking at this pink and yellow tonight.
Kevin, take it away. If you need to
All
leave.
right. Well, one of the things we always like to do is take a group photo. So let's take our group photo. Everybody smile if you want to. Give us the peace symbol, because that's what Chloe likes to always do with us. And so that way I can tweet one of those out here in a little while. Another thing that we like to do, Sonia, and it's often hard, I kid that it's like, oh, trying to choose your favorite child. You're not supposed to have a favorite child, right? But we do have 5 of the 6 here that you chose. And in fact, actually, we've got Fred over there, who was one of the top 7 that you chose. But typically we have the client choose like their top 3. This was 3, 2, 1, bronze, silver, gold, whatever. But we know that we have all winners here because they're all fabulous Vizes. But we just thought we would ask you to see if by chance you had any thoughts about, you know, this one is my favorite, or these were my top 3, or anything like that. We always like to do.
Happy to do. So actually I feel like I need a bronze prize or something, or I should have, I don't even know. So actually I think the bronze, hang on, I'm just going to double check, just one moment. Okay, no. So bronze would be Johanna. And her work, because that was just fantastic, and thank you so much for the explanations. Silver would go to Lali. I loved the recommendations and just the depth of your graphs, and good to see the work that you did. And I would say gold to Nicole, because the question we really wanted answered as well as a comparison was the economic impact we had on the healthcare service. And you just answered that so incredibly well. And like I said, you know, that just helps us move forward and prove what we're doing, and that it's a much needed service. It's a huge gap in Australian healthcare, probably international healthcare. And yeah, and we've already utilized some of that data that you've had in business awards. So yes. So that would be the 3, but I'll tell you, when I began and I was listening to Simon, and then, you know, I thought, oh, I'm going to be in a bit of trouble here because I don't know how to choose. But yes, but anyway,
yes,
but I want to thank everyone.
Right. In boxing, we often have, in boxing, I think it is where there's 2 bronze for some reason, or maybe it's wrestling. Or some of the sports they do that. So you know, maybe we've got three bronze and a silver and a gold. But thank you so much, Sonia, for coming today. We really missed you 2 weeks ago.
I know. I'm sorry. I was so unwell, and I thought
this has been so much fun for me to see this, to see the interaction and see the explanation, because we typically don't get this much time to do that. If you had been here 2 weeks ago, we would not have had this in this approach. So thanks so much, Fred, for organizing this, and Sonia coming by, and thank you to our 5 volunteers for coming twice, and some of you presenting it twice and walking it through. Each time we learn a little bit more, yeah, we can't exist without our clients. We can't exist without our volunteers, and when they meet together like this, this is why we do what we do. This is fabulous. Thank you so much, cool, everybody, for your time today.
Yeah.
Thank you so much. And thank you for the impact that you'll make on Sunny Street in the future. You know, this is wonderful, and this is the second year we've worked with Viz For Social Good. But actually, all of you help move the service forward. So your work, just helps us to explain our service, and it's vital. So the recommendations, Lali, the work, Simon, Vivian, everything that you've put into that, we just continue to move forward with it. And so you essentially, I know you're volunteering, but actually you're helping our service be created for the rest of the nation. So thank you so much for your time and hard work.
Thank you.
Any closing comments from anyone before we go to bed or go to work or have coffee or full coffee?
It's 2:00 p.m.
Coffee and work.
It's late here.
Well, no,
Yeah,
I look forward to the next project. I really look forward to the next project. When is next? When is next?
We'll let you know. It's probably something happening in November, December.
Yeah.
But yeah, I think, Sonia, we're so happy, glad to be able to help. And if you win those awards, make sure you let us know. I'm sure I'll find you on LinkedIn, on Twitter.
Yes.
But
yes.
and I might ask you to send us an email with a bit of a quote or like a bit of a testimonial as well, because I mean that helps as well. Those guys.
Absolutely.
So congrats, everyone.
Thank you so much, everyone. And
thanks for sharing. Where you're living. Every day. It was quite fascinating to, hearing you talking about what you're living. There, and it was quite very touching. So yeah, good work, and yeah. Good with everything, really. It's a very touching moment. I try not to cry for a moment because it's very touching.
Sonia,
work.
Sonia, did I see that you vaccinated 12,000 people? Did I see that on LinkedIn yesterday?
Yeah. We vaccinated, yes, over 12,000 people now, but not just general public, also residents in aged care homes, and also people experiencing homelessness, because they're quite afraid and don't have a lot of information. So we've done that as well, and we've tested over probably 16,000 people now as well. So
COVID testing.
Yeah.
Again, it's a good lesson for the volunteers, and it's a good lesson for people to see that these are people in that data. We often just, this is data, and we're just charting data. But to stop and think about, what's really happening here, and what does this data represent? It's a really powerful message what you're doing, Sonia. Just really appreciate your organization so much.
Thank you. It's
thanks everyone for your time.
Yeah, thank you so much. It's I think even Vivian, I can't remember, I'm not sure who's it was Vivian actually. One of them, there was a negative feedback, one person, and I know who that is. And that person was upset with us because it was the only negative feedback we got in a couple of years. And that person was upset because they were suicidal, and we had to send them to hospital, and they were not happy about that. So the quotes, knowing those people who are saying those things, it's right. Every single I always say every single statistic and all those numbers you're handling are people and their stories. And so that's and thank you for helping us tell their story.
Keep in touch.
Yes, absolutely. Hey, as a professor in my former career, if I had one negative comment, I would be getting National Teaching Awards. So I hope you get that award, Sonia. It will be well deserved with only one complaint. Are you kidding?
That's right. I know. That would be wonderful. And I want to say thank you to both yourself and Frederick too for coming back and going through this, because it's so wonderful. it's just so vital for our service. So, and thank you for organising it and believing in our vision and what we do too. So, and if anybody would like to keep in contact, just add me on LinkedIn and we'll go from there. But thank you so much, guys. Awesome job.
No, really appreciate it.
Yeah.
Thank you so much. Frederick, make sure you stop the recording. All right, we'll see everybody. See all you volunteers hopefully next time.
Yeah.
See you next time.
Thank you.
Au revoir.
Au revoir.